Okay, here we go, part 2 of human reproduction. Today we're going to focus on contraception, we're going to talk about fertilization, conception, and then how to have a baby. So hold on to your hats and off we go. So, big question here. If you didn't want to get pregnant or get your girlfriend pregnant right now, what could or should you do? Well, the only 100% foolproof method of zero chance of pregnancy is abstinence. Abstinence means refraining from any kind of intercourse or sexual activity at all. Because unfortunately, there is a significant fail rate for the different methods of contraception. So people don't realize this, but let's say, for example, the male condom. Most people think, oh, if I use a condom, I'll be protected. Well, it has an 18% fail rate. So let's imagine a school where there's, say, 500 students. Of those, half female. Each of those is sexually active, and so 250 students. How many do you think are going to get pregnant? That's kind of a lot, right? It's about 40 or so, maybe even more. Gosh, that seems quite high, right? Well, think about the pill. Lots of women go on the pill. The fail rate for that is still 9%. 9%. That means that there is, about 22 women out of 250 that would be pregnant. That still seems quite high. And then, well, you could do permanent forms of sterilization. But that's usually after you've had all your children. And even then, there's still a slight fail rate. So I had a friend of mine who was in Ohio, and she never really wanted children. And she and her boyfriend had gone out on a date, and they used a condom, and she got pregnant, and so they got married, and they had a lovely child and a lovely family. So she decided that she would go on the pill. Well, that didn't work, and she had baby number 2. Ruh-roh. Well, she was absolutely certain she didn't want to have any more, and so she got an IUD implanted. This IUD is an intrauterine device, and it's really quite a good, strong form of protection. Nope, baby number 3. So she insisted that her husband got a vasectomy. Well, baby number 4. Oh yeah, 4 babies, 4 different forms of contraception, and in the end, she had her husband have a second vasectomy, and she had her tubes tied, and I don't believe that she's had another child since, but I did lose contact with her. But how on earth did she get pregnant 4 times with 4 different methods of contraception, and each one being even more effective than the last? Well, it just happened that she was a fertile myrtle and her husband had super sperm. Well, how do you know that that's not you? Unfortunately, you don't until you find out the hard way when you get pregnant. So you kind of take a gamble, right? Anytime that you have intercourse, anytime that you have sexual relations, and you're using a method of protection, realize that it is not 100% foolproof. There still is a risk for getting pregnant. And we've not even talked about the risk of sexually transmitted infections yet, because most of these don't protect against that. Okay, so the only foolproof method is abstinence. Okay, so this is where you can ask me a question that you think your classmates might have. I will try to answer them. And there are no questions that I've been asked that have made me go, ooh, so feel free to ask away. So I'm going to explain a couple of these different forms of contraception. And I'm not endorsing any other than abstinence, but I think some of these are interesting scientifically, or that they are common and they should be explained, or they just annoy me, and I wanted to include those. So let's get started. So this first one, the patch, is kind of interesting in the fact that it is going to release chemicals that affect the one and only developing egg. It affects the zona pellucida, which I'll explain more about in a minute. So this is the outer coating of the egg that the sperm reacts to allow to fuse. Well, this particular medication, it's worn almost like a nicotine patch. It's put onto your skin, and it just stays there, and it leaches into your skin, which then gets absorbed, this medication that affects the one developing follicle, or the one developing egg, and it stops it from being able to be impregnated by the sperm. The interesting thing about it is it only affects the one developing oocyte, the one developing egg, so that the next month, if you decide, well, I'm going to get pregnant now, then that is not going to last in your system. The next egg, the next month is not affected. So it's kind of an interesting thing. If you want to be protected this month, but next month you want to get trying, then the patch may be your ideal form of medication to help with contraception, because others can take 6 months to get out of your system. This includes the pill. This one can take up to 6 months to get out of your system. The pill itself has been around since the 1960s, and it has given women some reproductive freedom. However, it is not as effective as most people think. On the box it says it's 99.9% effective. Yeah, that's in lab rats, and that's if it is administered at exactly the right time every day. Now, women are a little bit more flexible with when they take their pill. They're not going to take it at X amount of hours and X amount of minutes every day, each day. So there is a little bit of wandering, which makes it slightly less effective because it's time released. So it works out to be about 91% effective in humans, in females, which means that there's a 9% fail rate. So out of 100 women that take it, 9 of them are going to get pregnant whilst on the pill. Okay, well, you don't want to be one of the 9. How do you know? You don't. Okay, so this pill here is a time-release hormones. And what we know about the female reproductive system is that it is all hormone-based. So if you're taking these pills, it is going to influence how the hormones are going to be within the body, and so it causes the body to think, oh, I'm already pregnant, I don't need to make these eggs, I don't need to have the relationship where I could get pregnant because I'm already pregnant, and so it reduces the chance of you getting pregnant this time whilst on the pill. However, because it's hormone based, not all women can take it. If you have migraines, or if you have certain mental health disorders, this is not something that is going to be feasible for you. Taking the pill also has side effects and risks, such as it has a risk of increasing your chance of getting a deep vein thrombosis, a DVT, a blood clot. This also is increased if you smoke. So smoking and on the pill is not a good combination for women. The other thing is it can increase your breast size. Well, that might be okay if you are small-breasted and you want to become larger, but if you're large-breasted and you don't want them to grow anymore, the pill may have some other side effects. The pill also has the side effects of reducing your libido, that's your sexual drive. Well, if you're wanting it so that you can have sex and now this reduces it, that may be a problem. It can also cause issues like depression and anxiety. It can cause issues where it causes acne. In some cases, it can reduce acne. So there isn't just one pill. There are multiple different levels of these hormones, and so if you are interested in it, please speak to a physician and discuss your options. And if the first one doesn't work for you, then there is a possibility of trying different versions that may work for you in the future. But remember, it's not 100% effective. Oh yes, one more thing. If you take an antibiotic or certain herbal medications like St. John's wort whilst on the pill, it makes it ineffective. So if you are taking an antibiotic whilst on the pill, please make sure you use a second method of contraception, such as a condom, in addition to taking the pill, because otherwise your effectiveness goes way down. So the ring is something that kind of skeezes me out. I don't know why, but it does. This one here is where you have to insert this little circular ring, and it sits up and around your cervix, and it's going to release hormones just like the pill, but instead of having to take the pill every day, you have this ring that's inserted around your cervix, and it stays there, but you have to change it every time you have your period. And I don't know why, but that just kind of skeezes me out. But it just sits there. Now, if you don't put it in properly, that's the problem. And also, if you can't take hormones like the pill before, this is not going to have your desired side effect either. Okay, question. What does the pill and the ring have in common? Did you know that they have something called a female condom? It's a kind of a weird thing, right? But this is a barrier that gets inserted into the vagina and it sits up against the cervix. Now, you can imagine that if it is not inserted correctly, or if the penis is not inserted inside this female condom correctly, that's going to cause an issue. Absolutely. And we're going to talk about, can you put two condoms together? The answer is no, but I'm going to tell you more in a minute. This sponge is what annoys me. This sponge has been around as one of the earliest forms of contraception. They used to actually use sea sponges, and they used to soak them in vinegar and place them up inside the vagina, like years, hundreds of years ago. Well, number one, all that vinegar inside your vagina, ooh, ouch. Well, what was that going to do? It was going to denature the protein, so you can understand why they would have done it. And I feel bad for the poor sea sponges. Anyway, what they've been doing is they've now made it into a synthetic spongy material that gets placed up inside the cervix, and it contains a spermicide. So this is a medication that kills sperm cells. It has to remain inside the vagina up against the cervix for 6 hours so that the spermicide can kind of work. So it acts sort of like a barrier so the sperm can't get through the cervix, and then it has the sperm killing cells. But it only takes one, and if you pull this out too early or wonky, you can imagine how sperm can swim past and continue their journey, and then oopsie doopsie, you're pregnant. Now, this form of contraception has been around since my grandmother's era, so it's been around a while, and well, not really effective. Yet, if you look at a sponge packet, it's advertising to young people. It's at a rave. There's an image of a woman at a rave, and I'm like, no, this is really old technology. There is stuff that is far better than the sponge that is available, and it just annoys me. Anyway, so it is available, but not very effective, and really old technology. So this is the IUD. Mirena is one brand name, but they do have other brands. Now, this gets inserted in at your OBGYN's office. So they're going to put a speculum in, they're going to use a little tool that opens up the cervix, and then they insert a long driver and like a very long hook that pushes up this IUD, and the arms are up like this, and then when it gets to the top, the doctor will pull on the string at the bottom and the arms go out like this, and it sits inside your uterus, where it's going to prevent the lining from growing. So a lot of women like this because it helps to prevent pregnancy. It reduces the endometrial lining from growing, so you either stop having a period altogether or you have a period but it's really light, and it stays there for 5 years, so you don't have to think about it for a long time. Some women swear by it. Other women, well, the list of symptoms that you can get from this is rather long, and some women get all of them, where it's abdominal pain, that you have mood changes, you have pelvic pain, you have as it releases hormones, again, there are some women that will get migraines with it, that will have psychological effects with it. And so there are a long list of complications. In fact, there is a class action suit against Mirena right now. There are also some horror stories with this, where it gets wonky and implanted wrong into the side of the uterus and causes massive problems for the woman. But if you notice, there are some tails that hang outside the cervix, and these can actually poke the male in the penis during intercourse. That would kind of be a bit uncomfortable. There are even worse horror stories. So Mirena is the updated version of a copper coil. So they used to insert a copper coil, literally coiled copper metal. And it was a coil that would sit inside the uterus and again do the same thing as preventing pregnancy and preventing the uterus from growing and thickening. And so it would prevent a period. And it was very common to have 20, 30 years ago. But unfortunately, if the coil slips or moves, yes, there was a case whereby in the throes of making love to his wife, the husband screams out in pain because the coil had slipped and cut his penis, the head of his penis. Ouch. Nothing to ruin a mood like that. And it doesn't always work. Do you like baby's first toy? That's a good one, hey? Okay, no, I'm not demonstrating with a banana or with a cucumber. A condom is going to be put on the penis like these demonstrated pictures. Make sure it's put on the right way up. Make sure that you squeeze the air out of the top of the condom. And importantly, once it's been used, remove it from the penis away from the vagina. You don't want spillage to happen, that would defeat the purpose. And absolutely throw it away in the trash can, never down a toilet. Why? Because ecologically it doesn't go down the toilet. It actually can cause issues going into the water supply. Turtles will think it's food, it's not. Secondly, it blocks toilets very easily. So let's say that you're staying over at your girlfriend's house or at somewhere else's house and you flush a condom and then the toilet backs up and you're like, I don't know what happened. And they have to call a plumber in. They're like, we know what happened. Very expensive, oopsie doopsie. So trash can. Okay, if you want to be really safe, use 2 condoms. What do you think? Well, I do hope that you said false, because 2 condoms are going to cause friction and that causes the condoms to break. So if you use 2 condoms, whether it's a male, female, or 2 males, that is actually going to cause more opportunity for having pregnancy. So keep the idea that double bagging is only good for Publix canned goods, never for a penis. Double bagging only for public canned goods. So should you use 2 condoms? No, no, no. Can you use 2 different forms of prevention? Yes, like you could use a pill and a condom. That would definitely increase your chances of not getting pregnant. But there we go. Okay, if you sat here, I think it's time for a stretch break. Give a pause, go and have a cup of tea, go have a stretch in the sunshine, and then when we come back, we're going to talk about how babies are actually formed. So let's talk about how babies are formed from fertilization through to birth. Nothing in the bedroom part. We are going to talk about how this actually happens when you have a sperm that meets an egg, fuses, forms a zygote, and then grows and develops into a baby. And then how does it get out? Okay, so that's our next topic to talk about. So I have a little movie coming up that we're going to watch, and it's going to be great.
During ejaculation, Nearly 300 million sperms move from the testes through the tubes called the vas deferens into the area of the prostate. At this point, the prostate contracts, closing off the opening between the bladder and the urethra, releasing fluid into the urethra and pushing semen on through. The seminal forms a thick fluid that is alkaline in order to protect sperm from the acidic environment of the female vagina. The gel is liquefied by enzymes from the prostate gland. It also contains sugars to nourish the sperm. The seminal plasma is left in the vagina. Sperm use their tails to swim through the layers of cervical mucus that guard the entrance to the uterus. During ovulation, this barrier becomes thinner and changes its acidity, creating a friendlier environment for the sperm. On the other side, after releasing the egg, at about day 14 of the period, the egg arrives at a specific portion of the tube called the ampular isthmic junction. It rests for another 30 hours. Fertilization occurs in this portion of the tube.
Make this your best dress summer yet with Stitch Fix. Your personal stylist will send sew-you styles like colorful midi.
Once the sperm has entered the uterus, contractions propel the sperm upward into the fallopian tubes. To meet the waiting egg, sperm must travel from the vagina to the fallopian tubes, a tough journey that few sperm survive. This process may be nature's way of allowing only the healthiest sperm to fertilize the egg to provide the best chances of having a healthy baby. The first sperm enter the tubes a few minutes after ejaculation. But, however, the first sperm are not likely to fertilize the egg. Motile sperm can survive in the female reproductive tract for up to 5 days. The magic happens in the fallopian tubes. The fallopian tube pushes the egg towards the uterus. Cilia push the sperm towards the egg. Also, the surrounding cells of the egg produce a chemical that attracts sperm. The sperm first burrow through the cells of the corona radiata. Then, upon contact with the zona pellucida, the sperm bind to the receptors in the zona pellucida. Then, the enzyme-filled cap of the sperm, called the acrosome, releases its stored digestive enzymes. Finally, the sperm must fuse with the egg plasma membrane. This event causes the egg membrane to change and prevent other sperm from attaching to it. Now attached, the sperm's nucleus, where the chromosomes are stored, enters the egg cell, looking for the egg's nucleus. Egg combines genetic material with the sperm to create a full set of chromosomal DNA with 23 pairs of chromosomes that contain a unique copy of half the genes of the parent source. This is the blueprint for a whole new, unique person that instantly determines gender, hair color, eye color, and many other characteristics. The combined sperm and egg is called a zygote. It is the earliest developmental stage. It divides rapidly in the days following fertilization. The zygote then travels down the fallopian tube to the uterus. After fertilization, the zygote continues to divide and morph into a blastocyst ball of 16 cells, approximately 5 to 6 days after fertilization. It is smaller than the tip of a ballpoint pen. Only 20% to 30% of fertilized eggs will reach the blastocyst stage. Embryos that survive this stage of development have a high implantation potential once transferred into the uterine cavity. The blastocyst hatches out of its shell and burrow into the uterine wall, endometrium, which serves as the source of oxygen and nutrients. About 4 weeks from the beginning of the last period, near the next period, the blastocyst has begun to produce the pregnancy hormone to tell your ovaries to stop releasing eggs. From then on, the menstrual cycle pauses. The blastocyst is called an embryo now. Home pregnancy test might be able to get a positive result. At week 5, the circulatory system, brain, and spinal cord are beginning to form. And the tiny heart will start to beat. The baby's heart beats about 54 million times before birth. The placenta provides oxygen and nutrients to the growing baby and removes waste products from the baby's blood via the umbilical cord. The nose, mouth, and ears are starting to shape at week 6. At weeks 7 and 8, the embryo has doubled in size since last week's. Little hands and feet start to grow. At week 9 to 12 of pregnancy, the embryo is called a fetus. The baby is almost fully formed and has completed the most critical portions. The facial features are more recognizable. The fetus's head is rotated and bent towards the chest, and he can occasionally touch his face. The diaphragm muscles start to grow. The reproductive, circulatory, and urinary systems are all at an advanced stage of development. The fetus will urinate in the amniotic sac. It is a sign of the proper functioning of the fetus's body. If the baby is a girl, her ovaries contain millions of eggs. If the fetus is a boy, his testicles will already start producing testosterone, male sex hormone, which is necessary for the development of his reproductive system. She or he is about 5 centimeters in size and 14 grams in weight. She or he is growing and maturing until ready to birth.
Let's talk about what happens to the woman while she's pregnant. So, it is typically made up into 3 trimesters. each being about 12 thereabouts weeks each, because you're pregnant for 40 weeks, so 9 months, 40 weeks. But there are some women that don't actually experience any symptoms whatsoever. It's rare, but yes, it can happen. In fact, it happened to a friend of mine's daughter. She didn't realize that she was pregnant. She had spotty, irregular periods to begin with, and then she just thought that her body was having weird period time. She was a heavy set young lady, and so she didn't actually show that she was pregnant. And when she came to being in labor and delivery, she just thought that she needed to go to the toilet and needed to poop but couldn't, and ended up with these terrible abdominal pains. And her boyfriend took her to the hospital, and lo and behold, she came out with a baby. She didn't realize that she was in labor or that she was pregnant to begin with. So it is possible. It also happened to my great-grandmother, but this was her 12th child, and she thought that she was going through menopause and that her corset was just a bit tight and she'd put on some weight. She ended up going to the doctor, and she came home with a baby, and we're like, oh, okay then. So it is possible to happen, but most people will experience these typical symptoms throughout their pregnancy. So in the first trimester, this is where you tend to get the morning sickness. Now, it doesn't mean that in the morning you wake up and you're like, oh, I feel sick, and then by mid-afternoon you're fine. This morning sickness is worse typically during the morning period when you first wake up, and it's due to the fluctuation of hormones and the fact that you have nothing in your stomach because you've been sleeping. And 85% of women will experience morning sickness, and it's to a degree of I feel a bit sick and nauseated, to I'm throwing up continuously and I can't keep anything down. I had a friend of mine who was hospitalized twice because her morning sickness was so bad she became dehydrated and hadn't had enough to eat for a while, and so she had to get IV fluids to help her with this nausea and this dehydration. For most people, though, about the 12-week mark, it all of a sudden switches off, and you're like, oh, that feels better. And you no longer feel this constant nausea, not wanting to eat, and eating only really bland things like saltine crackers, and trying to keep those down. About the 12-week mark, it lifts, and you start to get into the second trimester. So the second trimester is the honeymoon period, and you feel glowy. This is where you're starting to show, and you're starting to get a baby that you can see, and you have the effects, and your skin looks radiating. That's because lots of blood vessels are pumping blood to your surface of your skin. The hormones are making your hair look richer and thicker. In fact, your hair doesn't really fall out during your pregnancy, and your nails get thicker and stronger. And again, that's to do with the hormone changes and the prenatal vitamins you're taking. And you feel great, and it's a wonderful thing, and you're showing, and it's lovely. And then this is where you get those weird cravings start to happen. The weird cravings are partly to do with your baby requesting certain nutrients, and also these fluctuations in hormones. Some women have craved things like pickles and ice cream combined together. When I was pregnant with my daughter, I craved Taco Bell bean burritos, and it was such an urge that I had to have these Taco Bell bean burritos. I would kick my husband out of bed at 2 a.m. to go and get me a Taco Bell bean burrito. Thankfully, it was just down the street, and so he didn't have to go far, and thankfully Taco Bell was open late. But why bean burritos? Who knows? When I was pregnant with my son, I craved fruit and meat. Supposedly, depending upon what you crave, you can tell the sex of the baby. But I don't know about that. Yes, these cravings are really strong. Now, with these strong cravings, you also get cravings for emotional stability, which is completely not there anymore. When I was pregnant, I was an emotional roller coaster. Again, hormones. You get this when you are going through your puberty, you get this going through menopause, and you certainly get it going through pregnancy. So when I was pregnant, I would cry at the drop of a hat. Emotional things like seeing a happy advert, tears, absolute hysterics. I would cry at anything that was happy or emotional, and it was great. Combine that with these pregnancy cravings, I turned into a lunatic. One day, I craved Heinz baked beans, British baked beans, and I had to have these baked beans. Like, it was the only thing on my mind. I had to have these baked beans, and I needed them. Like, there was no question. I had to have baked beans. I was a rational thing where, you don't understand. I had to have these baked beans. Like, it was an addiction, that like nicotine addiction, crazy. I had to have them. All right, you get the point. There was only one place in my town that was selling them, World Market. And so my husband drove me, and I was kind of big at that time. And so I waddled into the store, and I went to the back section where they had the British section for these baked beans. And I looked on the shelf, and it was empty. Panic. So I go and find this poor clerk, this poor stocking gentleman who was stocking the shelves. I'm like, where are your baked beans? And he was like, oh, sorry, I guess we're out. What do you mean you're out? And I was like outraged, and then I was hysterical crying. I was like, you don't have any baked beans? Oh no. Yeah, this is over baked beans, people. So I leave the store and I get to the car and I am sobbing. I am hysterically crying. And my husband's there picking me up, and I open the door and he's like, what happened? Thinking like I had hurt myself, somebody had said something, I had been abused in some way. They don't have my baked beans. And I'm crying hysterically, and he kind of translates through the hysterical sob that they didn't have my baked beans, and he burst out laughing. And I go from hysterically crying to anger beyond belief to hysterically laughing at the ridiculousness of myself within a case of a second. And then you laugh all the way home. It was great. They didn't have my baked beans, but the hysterical and extreme emotions, I look back on now and laugh. But at the time, it was intense. So these cravings can be insane. A friend of mine actually craved dirt. Yes, actual dirt. And it was the only thing she could think about. And she was like, no, I'm not eating dirt. This is ridiculous. And every time she went outside, she would smell the dirt. It was amazing, and it was calling to her. And it was the only thing she could think about was dirt. I'm glad I didn't have that craving. But anyway, so she went outside, and eventually she gave into this craving. She grabbed a spoon, and she went and she took a spoonful of soil, of dirt. That was the only thing she could think about. That was the only thing that she needed. And she ate the dirt, and she said it was the most delicious thing she'd ever eaten in her life. And that after that one spoonful, she was cured, and she didn't crave dirt anymore. Pica, this is an actual craving for or eating of non-food sources as food. And she absolutely had to have this dirt. But in reality, it was her brain that was saying you're low on this particular mineral, and it was her olfactory senses. She could smell the mineral that was in the dirt that her body and her baby needed. And so it was this overwhelming desire to eat this dirt to get this mineral that was so needed in her body. If you actually have a craving for dirt or for something that's non-food source, please tell the doctor. She went back and she told the doctor what she'd done, and the doctor was like, we have pills for that. Please, you should have told me. Here, have this supplement, because it was a metal supplement she needed. Anyways. All right, so apart from glowing, your skin radiates, your hair and your nails are even stronger and luscious, and you have these weird cravings, your baby is growing and it's starting to move as well. There are lots of videos that tell you how big your baby is getting, and feel free to look them up if you're curious. All right, third trimester. This is whereby you get the nesting phase. This is where you're starting to clean and you're starting to gather all the supplies, getting ready for the baby, and you're getting excited. The baby's moving a lot, and you can feel the baby turn and twist and move and kick, and you're getting large. But it's also where you lose sight of your feet. The baby, the big belly, you can't see your feet anymore, and you get a lot of swelling in your feet and your ankles, and you retain a lot of fluid. Also, your feet grow. This may be something that might not know, but when you are pregnant, your body is going to release hormones that help to relax the bones and to relax it so that your hips can birth and get a little wider and to support the baby. But it also relaxes your teeth. If you had braces and you had your teeth fixed, but you don't have a permanent retainer on, be warned, it can actually spread your teeth again. But it also can spread your feet, and with the extra weight of the baby, your feet can actually grow up to a size. When I was before my children, I was about a size 6. I'm now a 7.5 after 2 kids. Your feet can grow, and so if you have this big shoe collection, be warned, it may not fit after pregnancy. So this nesting phase, you are going to want to clean things. You'll want to organize the baby's room. You want to paint it. You want to get it organized. A friend of mine got a nesting so bad that she was vacuuming the floor 3 times a day. She mopped the house at least twice a day, and sometimes these symptoms, like your pregnancy symptoms, can last for a while. She has mopped the floor at least once a day and vacuumed the house at least once a day ever since she was pregnant, and her kids are now in the 20s. I don't know how she has any carpet left, because she's vacuumed it every day since. Now, my husband would prefer that I had kept that nesting phase, but no, I've kept the crying phase. So if I see anything that's happy, sobs, any cute adverts, tears, right? The Folgers adverts at Thanksgiving times, or the Publix adverts where everybody comes home and everyone's sitting around the table, tears. Yep, sometimes these pregnancy symptoms last forever. Be warned on that. So there you go. All right, so the 3 trimesters, you get all of these different symptoms, and some of them last a while. Okay, let's keep going. So what you have to realize is that the baby is growing and developing inside the uterus, and attached to the uterus is the placenta, which then is attached to the baby via the umbilical cord. Now, the placenta is like a shopping trolley, a shopping cart. The mum puts in all of the good stuff, the baby takes it out and puts in all of the bad stuff, like all of the sugary tricks that they want in the supermarket, and then the mother takes them out and puts in all of the broccoli and all of the good stuff, and the baby takes it all out. Well, okay, so that was my analogy, because the baby's blood and the mother's blood don't mix. It is just this transference of the good stuff into the baby and the bad stuff into the mother, but the blood is not mixing. There is a receptacle for it, and that's the placenta. Now, the placenta, you have to realize, is going to be what we call the afterbirth, because after the baby is born, you have to deliver this. So this is actually what a placenta looks like. Above my head, this is a complete placenta, and you can see the umbilical cord connected to it. To my side over this way, you can see there's the baby with the umbilical cord, and it's connected to the placenta. Now, most people in America have the babies in the hospital, and the doctor is going to look at it to make sure that it is complete and whole, and then is going to dispose of it in biomedical hazardous waste. Okay. However, there are some cultures where they are going to plant this in the garden and put a tree over the top, because this was the connection between the mother and the baby, and it's symbolic. Other people eat it. Yes, some people eat it raw, some people cook it, and some people they dry it out and desiccate it, put it into capsules, and they take it. I don't know. No. Whatever floats your boat. Okay, there are lots of mammals will eat this. It is highly nutritious because it's going to contain lots of nutrients that are going to be there to replace for the mother. But most people are going to dispose of it. And again, this check to make sure it's whole, because the whole thing has to come out of the female, because if any of it's left in, it can cause issues. So it's made sure that it's whole, it's removed, and then off you go. So let's talk about the umbilical cord. This is the part that connects the baby to the placenta, and the placenta then connects to the mother. So things go into the placenta, out of the placenta, through the umbilical cord to the baby, and back out of the baby, through the umbilical cord to the placenta, back to the mum. So this is the superhighway between the placenta and the baby. And there are two arteries that are going to carry the blood to the placenta, and then there is a large vein that returns the blood to the fetus. The length of the cord varies from pregnancy to pregnancy and person to person. So it doesn't really matter the length of the umbilical cord, but the longer it is, the more likely it is to get wrapped around the baby's neck, which could cause complications during delivery. They could get strangled. But it doesn't really matter, because they in Western hospitals and all of that, they can check to make sure that the baby doesn't have any decelerations or of their heart rate or any complications, and they can then fix it if it is. So the umbilical cord is the superhighway between the mother and the baby to deliver the nutrients to the baby and remove the waste from the baby back to the mother. And what's interesting about this umbilical cord is that inside there are stem cells. These stem cells can be transferred into all sorts of different types of cells, and they can be then removed from the umbilical cord and cryogenically frozen, so that if in the future the child or a blood relative like a sibling gets a disease or a cancer, that these can actually be unfrozen and put into the recipient, and they can then change to help cure whatever ails them. So have you seen the movie or read the book My Sister's Keeper? This brings up a nice, interesting ethical dilemma. So this movie, the book's even better, by the way, is whereby they have a child and she gets leukemia. And so they have a second child in order to use the cord blood from her umbilical cord to help save the first child. And then this becomes this ethical dilemma is, do you then become your sister's keeper? Because then she also had to transfuse blood and bone marrow and kidneys, and I won't give the whole story away. But again, ethical dilemma. Really interesting. If you've not read the book, read the book. It's really good. Okay. So any idea what this is? Well, this is the amniotic sac. So what you can see here is that part that the hand is holding. That's the sac in which the baby was growing it in. And you can see the big, thick bit at the bottom. That's the placenta. And the umbilical cord is the squiggly thing that's on the inside. Now, most babies are born without still being inside the amniotic sac. However, there is something called an uncooled birth or a veiled birth, 1 in 80,000 births, where the baby is still born inside the amniotic sac. Now, most typically, the sac is going to break, and the water, or the liquid, I should say, that's inside the amniotic fluid, not water, the amniotic fluid is going to rush out, and that's your water breaking, hence being termed water, but it's not water, it's amniotic fluid. Now, this amniotic fluid is created by the baby actually peeing. So it swallows and it pees, and it generates some of this amniotic fluid that helps to cushion the baby inside the womb and helps it float around and move. You can see that when the baby's at term, there really isn't much room for the child inside this amniotic sac. And so as the baby gets pushed down into the pelvic region getting ready for birth, that sac can break and the amniotic fluid can rush out, and that's when the water breaks. The vernix. Now, the baby is going to be born with a cheesy, waxy substance all over it called the vernix. Now, the vernix is there to help protect the baby from the watery environment. Most typically, the baby is going to be rubbed down and cleaned up before given to the mum, and so some of this goop is taken off before it is seen. But if you actually look at a newborn baby, when they first come out, they're covered in mucus and blood and this vernix substance, and they're kind of ugly. But it's okay. They get better as they get cleaned up and the swelling and everything reduces. So if you sat in a wet bathtub or a wet watery environment for, say, 9 minutes, you'd be fine. 9 hours? You'd start to get really, really pruny. 9 weeks, 9 months, your skin's going to start to slough off and be damaged. These babies are in this watery environment for 9 months. And so this cheesy, waxy substance is going to help with the waterproofing and ensure that their skin doesn't get damaged by the environment. It also is showing some antibacterial properties to help with protecting the baby. Okay. As I said, babies when they're born are ugly. That's okay. When my son came out, he looked like a really old grandpa, all swollen. But it took a little while for him to reduce the swelling down. Now, speaking of swelling, not only is that their eyes that are swollen and looking puffy, but gentlemen, when your sons are born, don't be like, well, hey, that's my boy. It's swollen. It reduces down in size after a little while. Another thing that they don't tell you is that if it is a little girl, they can have a little period to begin with. They're not having a UTI. It's a normal thing where you might see a little bit of blood in their diaper, and it could be just due to the hormones that are affecting their body. Interesting. Okay. So what we're going to see next is an animated video of what happens during labor and delivery. So leading up to the time of delivery, you are going to see your OBGYN. So you're going to see your obstetrician. That's the one that deals with the pregnancy. So you go a first trimester to make sure that you're pregnant. You go again during the second trimester a couple times. And then during the third trimester, you'll go once a month, every 3 weeks, every 2 weeks, every week, and then every couple of days. And then right towards the end, just like it's almost every day, just to make sure that the baby's turned properly, it's head down, and that they check to see how far effaced and dilated you are. That means how thin your cervix is and how wide it's becoming to let the baby come down, and how far the baby's head is moving into position. You want the baby to be head down and with its back towards your tummy. If the baby is flipped around and it's back to back, it's a more difficult pregnancy and delivery, and they can reach up and rotate the baby to flip at you, or to flip the baby so it's easier and the baby can come out better. We'll talk about if it's butt first again in a few minutes. So you're going to go and get checked to make sure that the baby is in the correct position. Once it's determined that the baby's in the correct position and or that the water's broken and so on and so forth, then you progress into the active stage of labor and delivery, and you're going to do contractions to push the baby out, and then you're going to deliver the placenta about 15 minutes to half an hour or so afterwards. They might give you some extra medication to increase the amount of contractions after the baby is born so that you can deliver this placenta. And you might feel hands on you, like, what the heck's going on? And people are massaging your belly, and you're like, what? And that's them helping to stimulate the delivery of the placenta. Okay, so let's watch this video.
During a vaginal childbirth, the first stage of labor lasts about 12 to 19 hours and starts when your baby settles lower into your pelvis. In response, your cervix begins to efface or become thinner and dilate or widen. During this time, you may feel strong, regular contractions occurring every 5 to 20 minutes and lower back pain and cramping that doesn't go away. You may see a brownish or reddish mucus discharge, which could be the mucus plug at the opening of your cervix, falling out. Your water may break, which can either be a large gush of fluid or a continuous trickle. If you experience any of these symptoms, contact your doctor or midwife to see if you should go to the hospital. At the beginning of stage 2 of labor, which usually lasts from 20 minutes to 2 hours, your cervix is fully dilated to 10 centimeters, and your baby's head has moved beyond the cervical opening into your birth canal. Your doctor or midwife will instruct you to push during your contractions and rest between them. In a normal delivery, your baby's head will rotate to face your back. During active labor, your uterus is divided into an active segment that contracts, pushing the baby downward, and a flexible passive segment that remains relaxed, stretching to provide more room for the baby to pass through. When the top of your baby's head appears, or crowns, your doctor may make a small cut, called an episiotomy, to enlarge the vaginal opening. Then, your doctor or midwife will give you instructions on how to push your baby out. As your baby's head passes through the birth canal, it molds into an elongated shape. An elongated head shape will resolve itself within a few days as the skull bones shift back into place. After your baby's head exits the birth canal, his or her head and shoulders will rotate to help the shoulders pass through the birth canal. Your baby's shoulders are delivered one after the other in order to fit through your pelvis. Once the shoulders emerge, the rest of your baby slides out easily. After your baby is born, his or her umbilical cord will be cut. In stage 3 of labor, which may last 5 to 30 minutes, mild contractions will help push the placenta out of the uterus. During this stage, you and your baby may begin bonding through skin-to-skin contact and breastfeeding.
So, there is a term called breech. This is a breech birth where the baby has not turned and is not head down. So, if the baby is not head down but rather butt first or feet first, or in a way that is not head down, this becomes very complicated. So, this is whereby the baby has to be encouraged to move. So, for example, in the picture below, you can see this lady with a doctor who's manually moving, external cephalic version, moving the head externally and saying, hey, baby, turn, and encouraging the baby to move. And if that doesn't work, then the baby would need to be born with a C-section. Unfortunately, there are some cases whereby the baby is deciding, no, I'm coming butt first, and that's where it is. The problem is that it can dislocate shoulders and all sorts of things. But even worse is, what is the largest part of the baby to be born? Well, that's your head, right? In the video you just saw, the head skull bones actually are not fused, so it allows them to mold and get smaller. But the largest part still is the head, even though those skull bones are molding and moving and making it smaller to fit through the vaginal canal and the birth canal. And the pelvic girdle, the bones, it still is the largest portion. Well, my shoulders are larger than my head, yeah, but they're delivered one at a time, so it's actually smaller than the head. So if the body comes out, the feet are coming out, the hips come out, the arms come out, the head might still get stuck. Sadly, this happened to a couple in Scotland a few years ago, and the doctor said, oh no, you'll be all right. And it was like, no, I'm going to get the baby out. Push, push, push. And she pulls. And unfortunately, the head was too big to fit through the bones. And she decapitated the child. I know, it's so sad. It's so sad. The likelihood of this happening is so slim, but she still had to then have a cesarean section and remove the baby surgically, even though the baby had died. Yes, the doctor lost her medical license and she was sued, and it was all very, very, very tragic and sad. The likelihood of it happening again, really slim, but you can see how it could potentially happen. So instead, if the baby doesn't move via external rotation or move naturally, a cesarean section where they surgically go in and remove the child would be scheduled, because you don't want to have a breech birth and that happen. Did you know that it used to be the number one killer of women, not heart disease as it is now, but it used to be childbirth. Thankfully, with the invent of cesarean sections and all sorts of modernized medications and modern medicine techniques, it is no longer the number one killer of women. Hooray. Okay, here we go. Warning time. I am going to show you some graphic videos of birth. The first one that we're going to show is a video of a cesarean section. This is a surgical procedure whereby they're going to cut about the bikini line, just above the pubic bone, the pubic mons, and they're going to, about where your knickers sit, your underwear sits. And they're going to make a small incision where they are then going to cut through the skin, cut through the fascia, cut through the fat, cut through the peritoneum. They're going to cut through the membrane there and the muscle, and they're going to find the uterus. They'll cut that. They flip it over with the back of the scalpel so they don't try to cut the baby in case the baby's head's right there, which it will be. And then they're going to take the baby out. Now, one of the things that is not seen, or it may be seen, is that they bulb syringe the baby. Now, they're going to, it's like a little bulb syringe, or they might use a tube that they stick down the throat to suction out the amniotic fluid from the lungs and from the nose. Now, if the baby has had their first poop, which is meconium, during their time that they're in labor and delivery, and they've pooped whilst inside and it's now in the amniotic fluid, there is an increased risk of them inhaling that poop, and they don't want to do that. So they are going to have the NICU, the neonatal intensive care unit, there to suction out even more aggressively the amniotic fluid from the lungs and the nose and the mouth to make sure that they haven't inhaled this poop. And so it's interesting. Now, as I said, number one killer of women used to be childbirth, but now, thankfully, due to cesarean sections and the like, it's not. When should you have a cesarean section? Well, some women elect to have a cesarean section because they want it on a certain birth date. They want to have it on a certain doctor doing it. They don't want to have a vaginal birth because it's too much hard work. They don't want to ruin their vagina. No, right? A cesarean section is harder for the mother and it is worse for the baby. So it's harder for the mother because she's got an actual incision there, and it is an actual surgery. There is risk of complications. You can't lift anything for 3 months afterwards that is heavier than so much weight. So lifting things becomes problematic, even lifting your baby, because you've got an incision there that is starting to heal. Increased risk of a hernia, increased risk of complications, and right, it's surgery, okay? And less benefit for the baby. So as the baby's going through the vaginal canal, it gets squeezed, so it squeezes out the amniotic fluid from the lungs. As the baby goes through the birth canal, it also picks up the vaginal flora, which is really good for the baby because it's the first line of defense. But if they go through a cesarean section, they don't get that bacteria. So again, they might get a towel that wipes the vagina and rubs it all over the baby to give them some immunity and these bacteria from the vagina. Okay, so enough pre-talk. Cesarean sections, really good if they are necessary. Personally, I think that a vaginal birth is far superior than a cesarean section, and so therefore it shouldn't be an elective thing. But obviously, if you have to have it because the baby is not tolerating the vaginal birth, or that the mother can't give birth because of medical complications, then absolutely really useful. But just because you don't want to have a vaginal birth, personally, I think that's the wrong decision. Okay, let's watch the video. Again, it's graphic, so if you can't watch all of it, I understand.
Before the surgery,
You will receive local anesthesia. You will be asked to lie on your side and arch your back to open up the space between the bones of the spine and remain completely still. A needle will be inserted into the spinal area of the lower back. This may sting a little. A small catheter will then be inserted and left in the back, administering anesthesia throughout the procedure. While your anesthesia is being administered, the room will be busy as the nurses and doctors prepare the room with instruments and a warmer for the baby. Anesthesia can take about 20 to 30 minutes to administer. The powerful numbing will happen quickly and effectively. Once the appropriate anesthesia has been issued, a urinary catheter will be inserted. A catheter helps to ensure that the bladder is empty and as small as possible, keeping it away from the surgical field. Your arms will be strapped down in a T position away from your sides. This is done to prevent you from accidentally interfering with the surgery. A drape will be placed at your abdomen to keep you from seeing directly into the incision. The surgeon will begin by making an incision in your lower abdomen. The abdominal muscles won't be cut but will be separated to access the uterus. Next, a uterine incision will be made. You will probably feel a lot of painless tugging, pulling, and prodding, which is your doctor busy aligning the baby to get hold of the baby's head to cradle and pull them out. It's been about 5 to 10 minutes since your surgery started. Your baby will typically be briefly held over the drape to show you, the umbilical cord will be cut, and then the baby is taken away by a nurse to a nearby warmer. Here, your baby will be suctioned to clear the amniotic fluid. In a vaginal birth, these are squeezed out by the constriction of labor. After everything is finished surgically, your surgeon will stitch the incision closed. While the uterus is typically sutured closed with dissolving stitches, the doctor can close the abdominal incision with either staples or stitches. There are advantages to both methods. Staples are faster, saving around 7 minutes, and are associated with a lower risk of infection, while stitches decrease rates of wound separation and usually yield a finer scar. A C-section generally takes 40 minutes from start to finish. The anesthetic will wear off within 3 hours after your operation, and you will be encouraged to start walking within the first 6 hours of your surgery to prevent the formation of blood clots. Thank you for watching this video. Please watch my
So typically they're very careful about how they cut open the uterus to get to the baby, but unfortunately in really rare circumstances, this could happen. Poor little kiddie. Yeah, they cut a little bit too deep and they cut the poor baby's head. It doesn't happen often. So an epidural, this is what you saw in the video where she got pain medication placed into her back that numbed from that spot down. This is where they put the medication into the spinal space and they block the synapses. And remember, the neurons, the nerves, they are going to go one, there's a little space. So they flood the gap there to make sure that there is no transference of pain or sensation from that point down. Does it hurt? I've had 3. I've had 2 kids and 1 for a surgery. And so it's uncomfortable, you feel pressure, and you first get a local injection that feels like a bit of a bee sting in your back, and you're like, oh, that's unpleasant, but it's not bad. Now, there is complications with epidurals. They can leave you with a migraine that lasts for 6 weeks continuously, like a continuous 6-week migraine whilst you have a newborn baby. Oof. Yeah, it actually happened to my sister's sister-in-law. Not so good. Yeah, it was pretty awful. But the complications of that, really slim, but it still can happen. There are complications with epidurals, but they're slight. But you still should know about all of your options before going in. However, an epidural can make your birth process much better. You can use an epidural for having a vaginal birth to help with reducing, not eliminating all pain when giving birth, but you would certainly get a stronger version of this, a spinal block for a cesarean section. that you saw before. One of the other downsides of having a cesarean section is that you don't get to hold your baby straight away because you're still strapped with your arms out, partly again so that you don't put your arms into the field, but also so they can gain access to your blood vessels to put in medication and the like. So the person that's with you, whether it's a spouse, a mother, a partner, whomever it might be, they'll get to hold your baby before you, and so it takes you a couple of hours before you can actually, or maybe an hour or so before you get to hold your baby. They can get a baby out within 60 seconds, maybe even less, from start to finish in a cesarean section. It can be really quick because it's an emergency procedure. Amazing, right? I actually was lucky enough during my senior internship to see a complete cesarean section. I went and got the patient, I brought her into the room, I stood at her feet and I watched the whole thing, and it was really amazing. But the thing that really surprised me the most about it was how physical and physically demanding it was on the doctor and the assistant. They literally were, you saw a little bit, they grabbed, put their hands into the space and they pulled, and that was the way of separating the muscles, and it was really quite physical. Anyways. Okay, so let's keep going. We're going to watch now a vaginal birth. Yes, I gave you the warning, these are going to be graphic. So you're going to see the vaginal birth in a minute. The one that you are going to see is a lady who elects to have an epidural. You can have a vaginal birth with and without an epidural. You can have it in the hospital. The actual position that we tend to have the babies in, where you're lying down in a hospital with your feet up, is actually probably the worst position for the mother to give birth, because you're working against gravity and against your body. But it's the easiest for the doctor, so that's why we tend to do it like that. Anyway, so you could have a water birth. You could have the birth at home. You could have it with doctors, with doulas, with midwives. It doesn't have to be a doctor, but there are all sorts of birth options. So whatever you fancy, whatever you're comfortable with for giving birth, that's what you should do, but explore your options. So I'm going to show you a video now that is of a vaginal birth. You do get to see it all and to hear what's going on. The process of birth can take hours, or it can be really short. And again, it varies from birth to birth. And if you've had a cesarean section before, it doesn't mean that you necessarily have to have a cesarean section for the second or third birth. You could try a vaginal birth depending upon what the reason was for the cesarean. And so, yes, explore your options. This whole thing is your plan. Don't be pigeonholed and said, well, you must do this. The other thing that was really important that I was told was, if you don't get along with your nurse, feel free to request another one. When I was giving birth to Ella, my daughter, the first nurse that we had, well, our personalities did not match. I was not so pleased with her, so I requested a new person, and the experience was significantly better. So if I could give you a piece of advice, is make sure it's your plan, what you want, and that the people that are there to support you and to help you through match your personality. Okay, we're going to watch this video now.
Y'all here. Daddy's here.
At first, mom-to-be Lisa thought she'd try labor without the help of an epidural, the most common type of pain relief used in childbirth. Her husband, Rob, supported her decision either way.
She asked several times, and I was being stubborn. Finally, I said yes.
Epidurals are usually given once you're in the active stage of labor. An anesthesiologist places a thin tube into your back so that the medication can flow through it to bathe the nerves around your spine. The anesthetic and narcotic solution blocks the pain signals being sent to the brain and numbs your body from the waist down. Within 20 minutes of starting the epidural, Lisa's pain eases, and she feels calm and relieved.
Yeah, it hasn't been bad. The past couple hours have actually been pretty nice. No pain, no discomfort, really, just getting ready for the baby.
Lisa has 2 doctors helping with her epidural-assisted birth at Bryn Mawr Hospital in Pennsylvania.
Based on these right now, she is contracting every about every 2 to 4 minutes.
The contractions that I can feel are more of a tingling sensation than a painful sensation. I don't feel all of them anymore.
Dr. Philip Hirschman is supervising her labor, and her baby will be delivered by Dr. Joseph Castelli.
I'm looking at the clock and I'm like, okay, we're ready, and I'm not freaked out, I'm not in any pain, I'm not anxious. It's going to be a much more enjoyable experience.
For the most part, epidurals are safe and effective, but like all medical procedures, they come with certain risks. Make sure you talk to your doctor about whether an epidural is right for you.
Does the epidural make everybody itchy?
Most people. It does. It's that fentanyl and that continuous epidural. And you're not allergic to it, but it just makes you itch. 9 times out of 10, that's what you get. And it's the trunk, it's the belly.
The most common and minor side effect of an epidural is itchiness, mostly felt on the face, chest, and belly. The itching disappears once the epidural wears off. Because an epidural makes it hard to feel contractions and know when to bear down, it can make pushing more difficult.
We can allow the density of the epidural, how thick the feeling is, to wear off a little bit so that mom has a little bit more of a sense of urge to push.
Now that she's dilated to 10 centimeters, Lisa's ready to push. She gets coaching from her nurse and support from Rob.
We try to get 3 pushes in for every contraction.
During an epidural, when a patient's an epidural with pushing, they need help with their legs, and they need help also instructing them when the contraction's occurring, because they can't feel that pressure. 9 and 10, and again. You see, Rob?
Once I could feel where the pressure was and I could try to gauge my pushes towards that pressure, it didn't hurt. It was just tiring.
And again.
As the baby's scalp appears, Dr. Castelli arrives to guide Lisa through the final stages of pushing. After 45 minutes of well-paced pushing, her baby is almost here.
Okay. Beautiful. Excellent. That's it. Keep it coming. Let's bring that baby underneath that pubic bone. So just a nice gentle push. Good job. Okay. Good job. Just breathe.
The baby's nose and mouth are suctioned.
It's a cute baby. Okay, we got one loose nuchal cord, one little cord very loose around the baby's. Okay, without pulling, I want you to give a little push. Okay, good. You can stop now. That's it. And we're just going to gently guide the baby out. And it's a, what is it? It's a girl. What do you think?
As mom and baby meet for the first time, Lisa's doctor stitches up a small tear to her perineum that occurred during delivery. This procedure normally requires a local anesthetic, but Lisa is still numb and pain-free thanks to her epidural.
Congratulations. Yeah, my pleasure. This is beautiful.
Her name is Jules. She was born at 11:54, and she is 6 pounds 11 ounces and 20.5 inches long.
She looks great.
1 hour after delivery, the effects of Lisa's epidural are wearing off.
I don't have a headache. My right side of my body got a lot more epidural. It's taking a little bit longer for that one to get back to normal. There's a sensation like pins and needles, but without the pain that goes along with pins and needles. It's just like a tingly all over.
Within 2 hours, she's standing unassisted.
That's amazing. Pretty much back to me now, which is nice.
For Jules's mom, Lisa, an epidural was a great option.
It made the whole experience so much more enjoyable. The epidural worked fantastically.
So there is a chance of ripping during delivery of vaginal birth, that the baby's head puts too much pressure on the region of the perineum, and it is possible that you can rip either down or upwards. Now, if you rip upwards towards your urethra, that can cause complications. So doctors don't want that to happen. So if they realize that the baby's head is going to not fit through your vagina or would rip, they can make an incision, a cut called an episiotomy. This then opens up the vagina to make it a little bit wider. Now, typically, this is done when you have an epidural or mid-contraction, not typically with an anesthetic, and you don't really feel it because you're in so much pain because everything's hurting trying to push a baby out. Now, afterwards, they will suture up what they cut, and you just have to keep it clean. So every time you go to the toilet, you have to do a sitz bath, or you wash the area to make sure no urine or fecal matter gets onto this incision, and you just keep it clean, and then it heals itself. It doesn't mean that you're going to get an episiotomy next time you have a baby, but you might, and just be aware that that's there. After you've had your baby, you are going to get a period like you've never had a period before. It's because you're still flushing out all that's there. You can't use tampons or any inserted device, so you're going to use large sanitary towels to contain this massive period. When you stand up, you're going to be a little bit woozy, you're going to be a little bit, because you've just had a big baby. And so it can take a little toll on the mother for having had a child, and then dealing with the episiotomy afterwards and learning how to nurse a baby. It's very overwhelming, so make sure you have a good support system in place. Okay, and if you didn't want your bundle of joy just yet, what you gonna do? Abstinence. Good job. Okay. Next, you guys are going to watch the pregnant rat dissection. This helps to solidify the understanding of how all of the systems work inside one whole organism. You're going to see all of them run Mr. Sliced in one organism. You're also going to see the future of life being the little babies, and you'll see the umbilical cord and the placenta and the uterus and see how that all fits together. That will help. You are then going to create a fetus growing in a uterus out of clay. And then you are going to do some research on STIs, sexually transmitted infections, and of course your flip reflection. So if you've made it this far and you've done a great job on your notes, and you're feeling confident in everything, and you realize abstinence until you're ready for a baby. A baby's a wonderful thing. I love my children, but I couldn't have imagined having them as a teenager. Oof. But if you've made it this far and you're doing great, then high five you. Boop! I'm proud of you. You've got this. And if you've got any questions, feel free to let me know.